The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
It's a very controversial topic, testosterone replacement therapy. I think society's obsessed with testosterone. I mean, everywhere you go, I know here in Miami, you open up the Miami Herald sports section on a Sunday, and guess what? You're going to find all these clinics and all these places you can go that talks about testosterone issues and replacing testosterone. So it's nice that we're able to do this. And I thank ManMD, who has been a partner with me in the sense of providing very good quality care and a great avenue for not only good products, but also for these very educational, entertaining, informational sessions that allow men to be able to learn more about this in a more relaxed and not such a formal setting of the doctor's office. So before we can talk about testosterone replacement therapy, let's first talk about testosterone. I don't like to call it the men's hormone because women need testosterone too. Believe it or not, women produce testosterone. Their ovaries and their adrenal glands produce testosterone. But it is the hormone that sort of gives us these male characteristics. The beard, the deeper voice, the muscle mass. But it's something that is not just provides us with that. It allows us to think appropriately. It allows us to cognitively act a certain way, to reproduce. It gives us bone health. It gives us a lot of different things that if you were deficient in it, you have a laundry list of potential problems. We have 2 times in our lives really that we have these spikes in testosterone. We have it when we're first born and then during puberty, which is where, again, we start to see some of these secondary sexual characteristics. And again, it's not just about sex. It's not just about erections. It's not just about libido. It's about your overall well-being. And again, things are great when you have normal levels, but when you have abnormal levels, it's dangerous. And even in the setting of somebody who may not be that symptomatic, that is dangerous because these are the most dangerous types of situations. If somebody's walking around hypogonad, they have the potential risk of developing a lot of different issues, osteoporosis, even certain cancers. And so even in the setting of asymptomatic, you still should have this evaluated and potentially treated because of the risks. But of course, when somebody's symptomatic, it's easy because they end up showing up with all of these symptoms. And the diagnosis is simple. You check your blood. Usually it's 2 early morning blood draws, and that will give us the definition of whether or not you're hypogonad. There are different cutoffs depending on the studies you read. I tend to use more the 250 to 300 cutoff. We tend to see younger men with the higher levels and older men with the lower levels, but I've seen everything. I've seen 18-year-old men with a testosterone of 300, and they're perfectly fine. I've seen 90-year-old men with a testosterone in the 600s, and they're perfectly fine. Your body, if it's working appropriately, tends to make what it needs to be able to give you that physiologic level and allows you to live a healthy lifestyle. There's a lot of controversy between the chicken and the egg, which one came first, because we know there's an association with low testosterone and men who have obesity, who are diabetics, high cholesterol, high blood pressure. Another one, very common one, is obstructive sleep apnea. So the question here is, which one came first? The low T caused this, or did these cause the low T? But we do know that men who have hypogonadism, who have that treated, tend to improve a lot of these parameters, especially the metabolic syndrome stuff, the obesity, and some of the blood sugar control. So again, controversial, but there's a lot of connection there because there is definitely some interrelationship going on. But the question of which one came first, that could be a little bit difficult. So this is a ManMD sponsored event. So what I'm going to discuss is the different options that Dave can provide you with regard to treating your low testosterone issues. And it's really quite simple. We got 4 groups, all right? We got oral therapy, we got gels, we got injections, we have pellets, all right? Let's go and start off with the gel. So this is how the gel comes. It's a gel, and it's meant to put onto your skin, and that is going to absorb. We want to do that every day. Now, remember, this is testosterone replacement therapy. It's exactly what the word says it is. You are replacing something your body is not producing. So if you don't give it to your body, it ain't going to make it. You're not doing anybody any good. And so this one you do every day. You can see it's a pretty easy way to apply it. It almost looks like a deodorant stick. You do have to be careful with transference. That's essentially where you put it on your skin and somebody rubs up against you, whether it be your child, your wife, your mother-in-law. Maybe you don't really care about that one, but and so if they rub up against you, if it's not dry, you got to be careful because that can transfer to them and that could potentially cause side effects. Testosterone cypionate by far in my practice is the most common testosterone replacement therapy that I prescribe. It's been around the longest. It works the best in the sense that you're going to get your levels up there. Some of the dermals, the actual ones that you put on your skin, it's a little more difficult to absorb. Some people have thicker skin. The testosterone injections through cypionate, it goes right into the muscle. And you can inject your shoulder, you can inject your thigh, the quadricep, or the buttocks. And you do this every 1, 2, 3 weeks, depending on the patient and what levels we're looking for. You have a peak, and then after the first few days, it will begin to drop. You have 2 needles. You have an 18 gauge to suck the actual viscous fluid out and a 21 gauge to inject. You do not want to inject with the 18 gauge. Most people will do this at home, but you could do it in your doctor's office. You don't have to worry about the transference over to another person. But again, remember, you have to inject. If you do not do it consistently, you're not going to get good levels. You're going to feel bad. You're not doing yourself any service by not injecting. Pellets, these are little pellets that are actually placed under the skin. So it does require a little cut. We place them under the skin. You have strictly testosterone pellets, and you have a mixture of testosterone with anastrozole. Now, anastrozole is a medication that blocks the conversion of testosterone to estrogen. So those people who are aromatizing or converting a lot of that, you can use that combination and control the amount of estrogen you have in your body. And so it's nice because you place these and you do this every 3 to 6 months. So you don't have to be injecting every few weeks. You don't have to be putting a gel on every day. It is a little more invasive again. So you have to be careful with where you're going to get it done. It's not something you can do at home. There is a risk of possible infection and pellet extrusion where they come out, but that's very low. But it does give you this more physiologic level because you have this slow time release. So instead of boom, peak up, peak down, you get a nice steady release until the pellets completely are gone. And again, the nice one about this product is you have testosterone and anastrozole. And so you're going to have that conversion, that prevention of the conversion of testosterone to estrogen, which may help improve your testosterone levels and maintain some of those estrogen levels. Now, here's where I will give you my caveat on that. Estrogens are not they're not terrible for you. And honestly, the estrogens you need for bone health. So you don't want to bottom that out too much. But at the same time, with some of these replacement therapies, especially in some of the heavier set patients, you can have this conversion in your body, and that can cause gynecomastia and some other symptoms that you may want to control. The next is the supplements. This is oral therapy. I don't hate on quote unquote natural dietary supplements. Quite the opposite. I think we have to take this and be careful where you're getting some of these natural supplements. Remember, most of these supplements are not monitored by the FDA. If you're getting them from reputable sources, and again, I've used MenMD for well over a decade now because I think they provide a good quality product. They are one of these compounding pharmacies that receive the FDA stamp of approval, we'll say. And so it is a nice way of helping to improve what we're already trying to treat. And so these combinations of these quote unquote natural supplements do help improve some of these symptoms and help make you healthier. So something, for example, like DIM, that is one of the components there, is very similar. It's one of these estrogen receptor blockers. So they're very similar to what anastrozole does. And so again, it's a nice way of you can do it without a prescription. It's a nice way of taking something that's oral instead of having to inject or cut or put a gel on. You may need to use it for a good amount of time before seeing the symptoms improvement, and so it could take about a month or 2 to see some of that improvement. It's vegan, 100% vegan for those patients who are on any sort of dietary restrictions. And so again, just one other of the many things that MenMD provides that may improve some of your issues and may help treat some of these symptoms that you're having. So how effective is testosterone replacement therapy? Well, it's going to work. As long as you're getting the levels into your body that's going to get you to the normal levels, you should have an improvement in your symptoms if it is what's creating these symptoms. Now, remember, as I said, testosterone's become kind of a scapegoat in the sense that all these symptomatologies. You can have other things that are essentially providing it. Regardless, you want to have normal levels. So if you get your levels to normal levels, you're still having symptoms, well, you're still better off than you were before because you were hypogonad before, you have normal levels, but you may also now want to look at some other sources of what may be potentially causing these symptoms. But most men, when they get on testosterone replacement therapy because they're deficient, they have an improvement in their sex drive, in their energy, they have an improvement in their bone health, better sugar control, you name it. Really, it's impressive to see somebody who is deficient in it. You provide them with a replacement therapy that they need, and they really are different people. I mean, it's really a life-changing event. The risks, they do bring up in this slide set, the risk of potential blood clots. So if you have your leg that swells up or turns red, you have difficulty breathing or chest pain, those are all things you have to get evaluated for immediately. Very rare, but it's one of those things that gets said. The storage-wise, they do mention all the stuff you can purchase from NMD can be kept at room temperature. Okay, next slide. And prostate cancer. Testosterone replacement therapy does not cause prostate cancer. But if you have a history of prostate cancer and or have active prostate cancer and have been evaluated for screening, that needs to be addressed before starting any of these therapies, okay? We know that prostate cancer is not, testosterone does not cause prostate cancer. Certain prostate cancers may potentially react a certain way to testosterone replacement therapy, but I myself, in my practice, even have patients who are on active surveillance, meaning they have prostate cancer. We're monitoring them, and we have them on testosterone replacement therapy, and they're perfectly fine. Okay. As a matter of fact, we know that men who are hypogonad are a higher risk for prostate cancer and more aggressive types of prostate cancer. So this is the summary slide, just to give you an idea. Again, we got oral therapy, gels, injections, and pellets. Okay. So we'll start off again with the gels, simple, non-invasive, but again, you got to be careful because of transference. Another issue that sometimes I run into is you don't get those levels. Some guys just don't absorb it as well. Injections, you can administer it at home. You will not have transference issues, but it is an injection. So you got to give yourself a shot every few weeks. Pellets, they can last up to 6 months, sometimes even more. You're getting this more physiologic level instead of having the peak and the trough. Again, no transfers, but it's the most invasive way. You got to make a little cut to put them into your actual body. The supplements or the oral therapies, these are quote unquote all natural in the sense that these are things that you can buy usually in a vitamin shop or a supplement store. Does not require prescription. You can use it in combination to sort of an adjunct to what you're already doing. What's the downside? You're not going to get the same symptom relief usually by itself. And it does take some time for you to be able to see those symptoms. I think that might be it. We might be going to the questions now, everybody.
So to get started here, is there any foods that are known to lower the level of testosterone?
Yeah, anything that could be quote unquote poisonous to you. You know, if you're eating unhealthy, a lot of fried foods, high sugar, corn syrup, drinking a lot of alcohol, all the stuff they tell you are bad for you. It's not just bad for you in the sense it can give you heart attacks and strokes and all that. It can also lower your testosterone. Now, again, the question is it a direct effect, or is it something that because now you could develop potentially diabetes or metabolic syndrome? We don't know, but yeah, you want to try to eat healthy. There's not specific one thing of, hey, you know what, you shouldn't have this type of bean because it's been shown to drop your testosterone levels.
Alrighty. Next question here. I've seen this a few times. What size needle do you recommend for testosterone injections?
My go-to is an 18 gauge to actually remove from the vial, and either a 21 or a 23 gauge. 21, 22, or 23 is the typical vial gauge size that I would prescribe. 21, the benefit, it's a little thicker, so you get to suck it out a little more. It's because it's a very viscous fluid, but it's a thicker injection, so a thicker needle. 23, it's a thinner needle, but it's a little tougher to get the actual fluid out and to inject it into the actual thigh. So 18 to suck out, 21, 22, or 23 to inject.
Alrighty. Next question here, this is a question rather. I seem to get a small reaction when I inject testosterone, with the area being very sensitive to the touch for about a week to 10 days. Why may this be?
So the first thing that I always recommend is make sure the area is clean. You want to make sure that you use a little alcohol wipe to clean it. I would also probably alternate the area. So if you inject in the exact same area every single time, you're probably going to have some sort of reaction there. I've had a very, very small amount of patients that they just couldn't tolerate the the testosterone injections because of a local reaction that they had. Some of them, it was related to not injecting deep enough. So you want to make sure you're getting into the actual muscle. You know, the 1.5 inch needles is typically what we use. A lot of it also depends on body habitus. If you're having issues, let's say, with reaction on the thigh, you may want to move to the shoulder, or you may want to get somebody to inject the buttocks or the glutes.
Alrighty. So this question is another one that came up more than once before the event. What is an over-the-counter supplement you can take to increase male testosterone?
So again, I don't hate on supplements, these over-the-counter supplements, but at the same time, I'm not big on endorsing these supplementation, because again, you have to be very careful where you're getting it. These are not monitored by the FDA. If men are going to do this, one, you want to go to a reputable place, and two, you want to know whoever is managing this that you're on it, because they will affect your levels. And it's a little more difficult, for example, with me when I have a patient who I have on, say, testosterone replacement therapy, but they're taking some of these over-the-counter things, these quote-unquote natural supplements, and so you're going to find a number of things. The one that's provided through MNMD is excellent. I personally know the urologist actually created, who's an excellent andrologist as well. And so again, no major studies to show that it does make a huge difference, but the risk benefits ratio are definitely higher benefits than the higher risks. And so again, reputable, and just make sure that you are letting whoever is seeing you know that you're on it. That's my 2 recommendations. In particular, which ones I recommend? Well, there's some MNMD sponsored events. So I think MNMD, and like I said, I wouldn't be doing this if I didn't trust them. So I think it is a good product if that's what you're looking for.
Alrighty, certainly. And a follow-up to that question, someone else was asking if there's a daily prescription that you can take with your low T, and I don't think they're referring to a injection prescription, but something orally you could take rather.
Oral therapy that's prescribed, yeah. There are now oral forms of testosterone replacement therapy. Historically, we couldn't use them here in the United States because they were very hepatotoxic, bad for the liver. And ultimately what's happened is they've been able to bypass that. So now they can bypass that. We have now Jatenzo, Tilando, there's a couple of them out there now that you're going to start to see that I can tell you in my own practice, I do have a few patients on it. It's very difficult to get approved through the insurance because, again, typically these newer products are. But for those patients who have needle phobia, who aren't getting good levels with the dermals, it's another great option as well. And they don't want to obviously go through the little cuts for the pellets.
Next question here. Does having mumps as a child cause adult hypogonading?
Absolutely. Absolutely. Mumps is one of those risk factors that could potentially cause essentially testicular failure. So that's something I'll see in some of my fertility patients. That's something that I see in some of my adult patients. Usually by the time they're adults, though, if they had as a child, that's something that has already been addressed and they've been on lifetime testosterone replacement therapy. Another thing that I'll bring up, and I'm not sure if this is a question, is fertility. You do want to be careful on younger patients. If you have an issue with low testosterone and you're still within your childbearing age, you have to be careful because getting on testosterone replacement therapy may potentially affect your fertility. There's other options that you may have that may improve your testosterone levels, may actually improve your fertility, and I think that's something that we'll discuss. So I think there are some questions on that, which is clomiphene citrate or Clomid. And so anybody who has low testosterone, who has not had a fertility workup, should also have a fertility workup because it goes hand in hand. And the testicles, the most sensitive thing your testicles will do is produce sperm. It's easier for them to produce testosterone. So if you have low T, you can only imagine you probably have some issues with spermatogenesis as well.
Alrighty, certainly. I guess we can ask that question now. So the question was, my wife and I are trying to conceive. Is there a T therapy I can use that will not harm my family? You just answered with Clomid. Can you tell us a little bit more about exactly what that drug does?
Sure. So clomiphene citrate is a medication that was FDA approved many years ago for female infertility, but men and women are wired the same way. So the difference is the end organ, right? So stimulation of ovaries is one thing, stimulation of testicles is another. What Clomid will do is it works in the pituitary gland right up here. So in all of our bodies, the way that our bodies will shut down testosterone production when you get to a certain level is based off of estrogen. So your testosterone gets converted to estrogen. The estrogen goes up to the pituitary gland and shuts down the production of the pituitary gland, which makes two hormones, luteinizing hormone LH or follicular stimulating hormone FSH. And that's what triggers the testicles to do their job. So if you block this negative feedback, which is what clomiphene citrate does, your body's going to send more of this signal down there, which ultimately will get your testicles to produce more testosterone and more sperm or better sperm. So that's what Clomid does. It's a pill. It's actually safer in men than it is in women. And it's going to get your body to try to produce more of the testosterone by hyperstimulating your testicles. Okay. It's usually 25 milligrams every day. That's what we recommend. And so I give it and I prescribe it quite a bit for low testosterone issues and fertility issues, for any abnormalities on the semen analysis. And it's a great drug. In Miami, there's been a shortage, and so shout out and kudos to MenMD, who also provides clomiphene citrate. It's very well tolerated, usually not very expensive, usually very effective, especially in my younger populations. And so that is one of the big medications, big treatments that we'll use, especially in the younger patients, to improve their testosterone levels and to help with their fertility.
Certainly. Alrighty. Another follow-up question to that one. So other than Clomid, what options are available to raise T levels without shutting down natural T production?
The other thing that we can use is HCG. HCG is an injection. The medication is, depending again on what you're trying to do. For fertility, we use much higher dosages, but ultimately it looks a lot like that hormone that I talked about, which is luteinizing hormone LH. So it's going to bypass that pituitary gland and go and directly stimulate the Leydig cells and the Sertoli cells in the actual testicles to try to get them to function more appropriately. So HCG is also another medication that we'll prescribe that isn't testosterone. It doesn't affect fertility. That'll help you boost your testosterone levels.
Alrighty. Next question here is a fresh question. What is free testosterone and what can be done if it is low?
So free testosterone is one of the components. Testosterone is floating around your body, and it's getting bound by albumin, sex hormone binding globulin. And so the free testosterone is the one that sort of is able to penetrate the cells in your body. It's controversial because no major studies ever, they really only go by total testosterone. That's what we use when we decide if somebody's hypogonading. I've seen many times men who have normal testosterone levels and low free testosterone levels. And what I tell them is, yes, your free testosterone is low. Hypothetically, that's the stuff that's going into your cells, but it's very labile. And so it's constantly being bound and unbound and bound and unbound. So in the setting of total testosterone, you want to go by that because that's what the major studies show. Now, the men that tend to have lower free testosterone, heavier set men, more adipose tissue in their bodies, unhealthier. So you want to try to, again, live that healthy lifestyle, trying to exercise and eat healthy, try to lose the weight, and you're probably going to see that free testosterone go up. But it's controversial. And so I do get a lot of guys come see me for low free T, sometimes increasing their testosterone with maybe like a Clomid or an HCG might improve that as well. But it's a tough situation to see a patient has normal total testosterone with low free testosterone and they're requesting or they want to be on testosterone replacement therapy. I think if the total testosterone is borderline, I think it's reasonable. But if you've got a total T of 500-600 with a low free testosterone, that's kind of tricky.
Certainly. And I have a question similar to that coming up. So next question here is, what ways do you recommend to lower sex hormone binding globulin, SHBG, to increase free testosterone?
Yeah, that's what we talked about. So again, you want to try to be healthy, eat healthy, exercise. You want to try to stay away from the drugs and the alcohol. A lot of times that'll improve it. There really is no treatment that I can give to lower SHBG, but it tends to get back into its normal levels based off of the overall health of the patient. But again, controversial. There's nothing really we can give for that.
Certainly. Alrighty. And the last follow-up here, this person says something similar. They have total T is low, free T is normal. They're experiencing ED. Is the low T causing the ED?
So the reality is testosterone is not really a treatment for erectile dysfunction. And, I've given these talks about erectile dysfunction here, and, you do have pills, gels, injections, and an implant. So there's a lot of things that we have for that too. Might they see an improvement in their erectile function with better testosterone levels? Sure. And again, we mentioned this. The low testosterone is dangerous. And so you want to treat that. You get your total testosterone to normal levels, hopefully that's going to improve some of the sexual dysfunction that you're having. But those patients may also need to take a treatment for the erectile dysfunction. Sometimes it's an allophil or the sildenafil that is available for purchase in the MenMD, on the MenMD website. So yeah, I would treat it. I would treat the low T, even though the free T is normal. And hopefully that might fix some of the problems you're having. And maybe there'll be some of these other symptoms that they're not talking about, such as the issues with concentration, the fatigue, the loss of lean muscle mass. That hopefully will also improve if they're having.
Certainly. All right. Moving right along. This one has come up multiple times. What is the lower limit for a low T diagnosis for a man that is 60 years old?
So again, there's no normogram per se for age-related testosterone. I've seen it all. The 18-year-old guy at 250, 300, and the 90-year-old man at 600. Your body typically makes what it needs. So the lower limit of normal is 250. That's really what's been shown on the major studies. 250 to 300, more or less, is what we use. The upper limit of normal being about 850. So.
Alrighty. Why is it the testosterone levels decrease instead of increase with age?
So everybody wants to talk about menopause, but nobody wants to talk about menopause or andropause. It's a part of life. As we get older, our body starts to, I don't want to say break down, but it's like a car, right? The news we got is the day we're born, the day you drive off the lot. And so we reach that peak somewhere in our, teens, 20s. Depending on your lifestyle, you may be able to maintain that. And that's why it's so important maintaining a good lifestyle. But we do start to see a decline. And it's not like a woman like menopause where they hit a wall and that's it. Typically not. You usually see this slow decline over time. And it's ultimately, it's not gonna, it's not really something you can get away from. Menopause, andropause is something that awaits us all. Unfortunately, we're doomed. But there's plenty of treatments and plenty of things that we can do to try to get our levels to more normal levels to provide a good quality of life and a healthy lifestyle.
Certainly. Alrighty, next question here. How do you balance hemoglobin with testosterone?
Great question. So we know that one of the side effects of testosterone replacement therapy is an increase in hemoglobin and hematocrit. That needs to be monitored. One of the things that I will check in all my patients every 3 to 6 months is the hemoglobin and hematocrit. The way I treat it is donations of blood. You got to phlebotomize. Down here in Miami, we use One Med. No, it's called One Blood. But I'm sure certain Red Crosses you can donate. Some guys have to donate every quarter. Some guys don't have to donate at all, and others can do it sporadically based off of the levels. And so, yeah, that's something you have to keep an eye on. That's something you have the potential for heart attack and stroke, and if it gets too high. And so that needs to be addressed and monitored.
Certainly. Next question here. What is your understanding on HGH and its effects on low testosterone?
I don't really deal with growth hormone. I don't prescribe it. It's not something that I personally in my practice feel comfortable treating. There are plenty of urologists, andrologists, endocrinologists out there that do use it. And so because of my lack of expertise and lack of outside of my scope of practice, I'll skip that question.
For sure. That is understandable. Next question here. I'm 60 years old and have no energy. Is this caused by low T?
The answer is maybe. Again, it's something you want to get evaluated for. So the 2 early morning blood draws should be necessary. A lot of my patients who have the predominant symptom of fatigue, they do also have low T or borderline low T, but the underlying issue is actually obstructive sleep apnea. And so probably the one doctor that I refer the most to is a sleep specialist. We know obstructive sleep apnea at night, we sort of refuel our tank. And so, you go to sleep, you're here. Every time you go into appropriate REM cycle, you boost, and then you boost, and then you boost. When you wake up, you're up here. Well, if you got sleep apnea, that's going to be an issue because you're going to wake up with these blunted responses, and instead of being up here, you're down here. Tank is half empty. Sleep apnea, we know, increases risk for heart attack and stroke and a bunch of other things. And so, if the predominant symptom is fatigue, you have a very high likelihood you may have low testosterone, but it may be related to obstructive sleep apnea. That's something that should be evaluated, which it could be treated. And a lot of these patients you treat that, their testosterone production may go up on its own.
Alrighty. Next question here. My T levels have gone up to 900. Why isn't my male unit working right without the injections?
I assume that the injections you're talking about is the trimix and bimix injections you can also purchase on the MenMD website. Again, that goes back to that comment I made, which is that I get a lot of patients that come to me and say, Doc, I got low T. And I say, why do you think you have low T? And they say, well, because my penis ain't working. Well, yeah, you can have, most guys who have normal testosterone and still have ED. And so erections really, it's a multifactorial thing. The stars have to align to be able to give you an erection. And so it's very common to see men who have normal or 900 testosterone. That's great. That's really good levels, but they still have issues with erectile dysfunction because of the arterial dysfunction they can have, the venous dysfunction they have, the nerves aren't firing right, potentially have some issues with Peyronie's or some architectural issues. And so, yeah, you may need to use the other therapies that are meant to treat erectile dysfunction, which are pills, the sildenafil, tadalafils, the gels, the bimix gels, the trimix or bimix injections. And if nothing else works, you got the penile.
Alrighty. Next question here. This person says they used to get low T creams, which I believe are gels, but they said they stopped seeing their urologist due to the lack of appointments and cost. They're wondering if they can restart with you, Dr. Martinez.
Yeah, I'm happy to see you. You could call the office 305-275-5525 and make the appointment. We're happy to see you.
Alrighty. Let's see. So next ones are going to be in this TRT therapy section, even though we've kind of already been in there. This person wants to know, can testosterone replacement therapy help with my ED? And if so, why not?
It could help with your erectile dysfunction. Again, as I said before, the real recommendations from the American Urologic Association, you got the pills, you got gels, you got injections, you got implants. We're not talking about the gels or the injections of the testosterone. But yes, one of the symptoms, one of the things that the many multifactorial issues here that can cause ED may be hypogonadism. And so again, for not just erection issues, but if you get evaluated and you have low testosterone, you want to get your levels to normal levels, whether that be with testosterone replacement therapy or some of these other supplementations that we have available.
Alrighty. Next question. If you're on immune suppression drugs, will testosterone treatment work or affect its treatment?
Yes, it will. Of course, it's always recommended that if you're on any sort of immunosuppressive drugs, you'd want to discuss with whoever's giving you that, the medication, any medication before you start. We know actually that the immune system will be lower, abnormal, not functioning appropriately. Your immune system drops if you have low T. So having normal testosterone levels will give you better immunity. It might be beneficial actually to be on testosterone replacement therapy if you have an issue with your immunity, based off, of course, your testosterone levels. So the answer to that is, yeah, you should be able to be on it, and you may want to be on it if you have testosterone deficiency.
Alrighty. Next question here. Can low-dose TRT be delivered safely in the long term? I believe they're referring to more than 10 years.
Yeah, well, testosterone replacement therapy is a lifetime therapy. So like any organ that stops making a hormone, if your thyroid stops working, you need Synthroid, you need a replacement. Your pancreas stops working, you need pancreas. What is diabetes? Lack of making insulin, the hormone insulin. So if you have an issue with not producing appropriate amounts of a hormone, you need to be on the hormone replacement therapy, and that's a lifetime therapy. So it's actually more dangerous to stop it because you get to year 10 or 20 or whatever. It's not meant to stop. It's meant for you to be on it for the rest of your life. Now, if you're on testosterone for other reasons that have nothing to do with being deficient of testosterone, then yes, that could be detrimental. And the more you're on it, unfortunately, more than likely the more you're going to need it because your body will, as we said before, will stop producing its own intrinsic production of it. But if you need it, that's a lifetime therapy.
Alrighty. Next question here. This person says they're currently injecting 1 milliliter of testosterone every 2 weeks. Is this a standard or maximum amount, or does this vary depending on the person?
It varies depending on the person. My typical starting dosages are exactly that. 1 milliliter, which is 200 milligrams every 2 weeks, or a half a milliliter, which is 100 milligrams every week. You can go up and down. I got some guys I need 200 milligrams, which is 1 milliliter every week. I got guys I need to do 0.25 of a milliliter, it's a quarter of a milliliter, 75 milligrams every week. You got to tweak it based off of the numbers. So I check my levels on my patients every 3 months. But the standard is typically that, which you're exactly on, which is the 1 milliliter every 2 weeks.
Alrighty. Next question here, we briefly touched upon this earlier about testosterone replacement not causing prostate cancer, but this person wants to know if it can cause any other forms of cancer or side effects and what the disadvantages might be.
So again, if you have low testosterone, you're at risk for heart attack, stroke, cancers, all these different things you could potentially get. Unfortunately nowadays, because testosterone, I think, has been abused, and there's a lot of people that are on testosterone replacement therapy that probably didn't need to be on it. You're seeing a lot more of those 1-800 bad drug commercials. You're seeing a lot more of the black box warnings. There was some very controversial studies that came out many years ago, which have been debunked, that stated that testosterone causes heart attacks. If you have low T, you're at a higher risk than if you are on replacement therapy. So the moment you get on replacement therapy, your risk actually goes down. And once you get to normal levels, your risk actually goes down. Now, something like prostate cancer, of course, let's say a very common situation. I'll see somebody in my office whose PSA is going up once they started on testosterone replacement therapy. Those men need to be evaluated because although prostate cancer, testosterone does not cause prostate cancer, not all prostate cancers will react to testosterone replacement therapy. There's a subset of patients that may. And so that needs to be evaluated, needs to be addressed. And once it's been addressed, then at that point, again, the risks, the benefits when you need it are much lower than the risks.
Certainly. Next question here. What do you suggest to prevent testicle atrophy when on testosterone replacement therapy?
So most guys that are on testosterone replacement therapy will see atrophy of the testicles. Now, most of those guys already have atrophy because of the fact that comes with hypogonadism. So most guys, if they had normal sized testicles and they get on testosterone replacement therapy, maybe they didn't need to be on testosterone replacement therapy. Some people will use HCG to maintain that testicular girth. Understand that does not maintain fertility. So some guys will come to me and say, well, I've been on testosterone replacement therapy and they had me on HCG, so I don't stop producing sperm. That doesn't necessarily work that way. You may have a testicle that looks normal, but it's just a shell, essentially. The stuff on the inside still isn't working as well. So I tell most of my men that I have to be on testosterone replacement therapy, listen, at this point, you need it. They're just hood ornaments right now. And so just get used to the fact that you're going to have testicular atrophy because the key here is we're doing this more for your health. It's not so much of a vanity thing and wanting to maintain good testicular girth. But what's used very commonly is exactly that, the HCG, to try to maintain that girth.
Alrighty. Next question here. I'm currently injecting myself with testosterone twice a week. I feel no different if I inject or do not. Should I continue this therapy?
So the recommendation is actually after using it for a few weeks, maybe a few months, if you're not seeing an improvement, you may want to stop it. Again, depending on your levels. If you go to hypogonad levels, that could be dangerous. So you may still want to be on replacement therapy. That's something that has to be discussed with whoever's managing that. If you drop back and you're low normal or normal, if you're around that 250 mark and you didn't really feel a difference when you were on and you went up to normal levels or more quote unquote normal levels, then yeah, it's probably beneficial to you not to be on the testosterone replacement therapy. But again, a lot of these symptoms may not be related to testosterone because it's become a scapegoat nowadays. A lot of people, they're pointing their fingers. So you may want to consider stopping that if you really haven't seen any improvement, especially if your levels were low, normal to, right around that border area.
Alrighty. Next question here. If testosterone replacement is not advisable because of heart or other conditions, what options are available?
That's a tough one. You could have the discussion with your cardiologist to see if something like clomiphene citrate, something like HCG may be something that they would be comfortable with. But yes, one of those two contraindications, somebody has congestive heart failure, really bad coronary artery disease. For example, my practice, I need clearance from their cardiologist before I do anything like that.
Alrighty. Next question here. As a prostate cancer survivor, is testosterone replacement a risk?
So hypothetically, no. If you've been treated and the cancer is gone, you should not have any trouble. Now, of course, the PSA and the evaluation need to be done to monitor. But the hypothetical, the answer there is no, should not.
Okay. Next question here. This person says that they asked their urologist if a T-boost would fix their ED caused by their radical prostatectomy done back in 2016. He replied, no way. Why may this be? My PSA is 0.
So again, it goes back to the answer of testosterone replacement therapy is technically not a treatment for erectile dysfunction. Having a prostatectomy can cause erectile dysfunction. It's very common. But it doesn't cause erectile dysfunction because of a change in your hormones. It causes erectile dysfunction because of the vascular nerve changes that your penis will go through when you have prostatectomy. So I agree with your urologist. Now, is it worth checking to make sure that that's not one of the many factors that could be causing it? That in combination with the prostatectomy, sure. But technically, it's not the true treatment for erectile dysfunction. Again, pills, sildenafil, tadalafil, for example, Bimix gel, trimix or Bimix injections, or an implant. Those are the 4 major treatment groups that we recommend.
Alrighty. Next question here is an interesting one. I haven't seen this before. This person says, could radiation treatments for prostate cancer affect my mental health by causing low testosterone?
So for radiation, again, radiation therapy for prostate cancer directly should not affect your hormonal status. One of the common things that will be given with radiation for prostate cancer is Lupron injections or bicalutamide. These are essentially medications that are meant to drop your testosterone. So in the setting of somebody who had radiation together with androgen deprivation therapy, yes, you're going to see a drop in testosterone, which ultimately causes erectile dysfunction and other things. But it's not so much because of the radiation, it's more because of the androgen deprivation therapy. By itself, radiation cannot cause low T, but it can cause ED, erectile dysfunction. So the same way, same treatments that we talked about for the prostatectomies, you may want to look into that for the treatment after radiation therapy.
Alrighty. Next question here is about pellets. This person wants to know how big the cut for the pellets is and what percentage of men use this treatment method.
So the cut's about 1 centimeter, is not very big at all. You don't want to make it too big because it's more likely to have these pellets come out. But about 1 centimeter in size, maybe a little bit more. Percentage-wise, I couldn't tell you that number. I will tell you in my practice, I don't have many patients on pellets. It was historically a pretty popular therapy. Ultimately, what happened is that insurance stopped covering the pellets, and so it made it a little more difficult. Not only that, the downside of it is you do have to make a cut. It's a little more invasive. You place them in the buttocks, and so you're getting also scar tissue. But I will tell you, the most physiologic way of getting your levels to a steady state and a less of that peak and trough are pellets. So it's a great therapy. But I couldn't tell you exactly percentage-wise how many patients I have. In my practice, a very small amount.
Alrighty. Next question here is also about testosterone pellets. They want to know if the testosterone pellet procedure is an outpatient procedure. Can I go to work the next day?
You could probably go to work the same day. It's all local. It should not take you any longer than just a regular visit to the doctor. And most guys are able to go to work the same day. They might be a little sore there, but it's not typically something that's going to prevent them from working. Now, if your work is real physical, you may not want to do that the same day. If you're sitting at a desk, I don't see a problem why you couldn't go back to work.
Alrighty. Follow up to that. What's the best location to get the testosterone pellets implanted?
So usually the superior lateral aspect of the buttocks. So if each let's say butt cheek, you break that into 4 quadrants. It's the top right or the top left. That's where you want to go to try to put these pellets into.
Alrighty. Next question here is from the chat. What is your take on all of these men's online clinics using a low dose of N-clomiphene to raise T levels without stopping natural production?
Again, I'm a big fan of clomiphene and N-clomiphene. Sorry about that. It is, again, meant for men who have low testosterone, so not just for any man who just wants to enhance their levels. If they're normal levels, I don't recommend it. But if you're abnormal, I like trying to do the more physiologic thing, which is try to get your own body to make it. So, and clomiphene, like clomiphene, essentially they're like cousins. They work great. They're very effective. And it's nice because a lot of these guys will be able to rehabilitate their testicles. So I usually keep people on it for 6 to 12 months and I stop it. Some guys will stay with the normal levels. Others will drop and they have to get back on it. Very rarely do I get somebody who goes up to certain levels and stays up there. Most people will drop, but most of the times they'll be higher than they were before. So I'm a big fan of clomiphene.
Alrighty. Next question here. How long does it take to notice results from testosterone gel?
So all these, it takes a little while, maybe a few weeks, for you to get to those physiologic levels and you're going to start feeling better. That goes for any of these, whether it be gels, the injections, or the pellets. Now, again, the supplements takes a little longer. So supplements, you may actually, if you're going to be, let's say, on the MenMD supplement, you probably want to wait potentially a month or 2.
Alrighty. Next question here. Can I get testicle implants if I'm feeling self-conscious about my small testicle size?
Yes, you can. The testicular prostheses are actually made by Coloplast, the company Coloplast. That's what I use. It is feasible. It is possible. Most men, though, that receive this are guys that have had an orchiectomy or have no testicles. So it may be a little more difficult to do when you actually have a testicle, although be it atrophied. Again, for the atrophied testicle, you can try something like getting on clomiphene and see if that helps, and or the HCG.
Alrighty. Next question here from the chat. If I start taking T, will I be able to hit the gym again like I'm 30?
So that's not what it's meant to be. That's more of a recreational anabolic steroid use, I don't know where society, unfortunately, has gone to where they 50, 60, 70, 80-year-old men want to feel like they did when they're 18, 19, 20, or even 30. It's about being healthy. So yeah, getting on testosterone, you're probably going to be lifting more at the gym. I would expect. Again, if you needed it because your levels were abnormal, and you notice it because in the gym you're not getting lean muscle mass, you're not burning the fat that you would expect at your age, and you have that low T, then sure, absolutely, that's going to improve your performance in the gym. But it's not meant for that. It's meant for really more of a healthy lifestyle type of situation.
Certainly. All right. Next question here. Can testosterone replacement therapy overstimulate your heart like having too much caffeine?
No, typically not. Again, it's about normal levels. Now, men who are abusing testosterone replacement therapy, men who are on anabolic steroids, that's going to create hypertrophy of muscles throughout your body, including the hypertrophy the growing, the thickness of the heart muscle. And so from that sense, sure, you can see some issues there. But it's not going to cause typically tachycardia, which is an elevation in heart rate. It should not cause that.
Alrighty. Are testosterone levels elevated in the morning or at night?
It's in the morning. Early morning before 8 a.m. because that's when you start, during the night is when you start having these spikes to get you to more normal levels. So that's why you need to do the test before 8 a.m. Afterwards, it sort of becomes labile and it can go up and down. But the test is done that way because you're going to see these more stable, higher levels during the morning. And, again, later on in the evening, we'll say closer to the morning time. So first thing when you wake up, you want to do that test before 8 a.m.
Sounds good. So follow up to that, saw this before. What is a low T test? Is this a blood test? Can you describe that for us?
It's an early morning blood draw before 8 a.m. Always recommend people go in without having to eat or drink anything.
Alrighty. Next question here. Can testosterone gel be applied over tattoos?
Yes, it can. Now, it's a great question. I actually never had that. I have plenty of patients who have tattoos and they have no problem with the dermal applications. I don't believe that, let's say, something with specific, maybe a thicker layer of ink should cause issues. I got men who have full tattoo sleeves, and that's not creating an issue. I don't know if that's going to affect. Actually, the better question is, will it affect the artwork? And over time, could that make the tattoo maybe become a little less artistic, and they may need some touching up there. But technically, it should not. It should not have any issues if you have a tattoo that'll put the gel on.
Good to know. That's definitely a good question. So, quick follow-up back to our low T test question there. Is the free testosterone a separate blood test, or is this also done at the same time?
Usually done at the same time, so it's part of the same blood test, but it is a separate order. So when you go to get your testosterone levels, my typical ordering panel is total and free testosterone that I check. And so it would be the same blood draw, but it needs to be specifically ordered or else it will not be done.
All right. Next question here. I've been seeing ads for companies that offer at-home tests to prescribe low T treatments. Do you recommend using these at-home tests over going to see my physician?
You broke up a little bit. I think I got it. They're asking about at-home testosterone test, right?
Yeah, they're asking if those are preferable as to doing that in person with the physician.
I would say probably the in-person is best. I honestly, I had heard of a test that was available, but it was very rudimentary, which essentially just said your low T versus high T, that's it, or low T versus normal T. And so I think, especially the testosterone test, I tell everybody, for example, it's such a specific test. We have to do it early in the morning. It could take up to 2 weeks for us to get the results. So I would recommend doing it at a professional actual lab so you can get more accurate levels.
Alrighty, certainly. So our next question here is another follow-up for the gel. This person wants to know where you can apply the gel best. Can you apply this on your thighs?
You can. So common areas: armpits, thighs, shoulders, neck, chest. Those are common places that we'll see people put it. Definitely, by far, probably the most common is the shoulder area, this area right here. And I think it's part of it's just real easy to place.
Certainly. Alrighty, next question here. What are the risks of going above the suggested testosterone level, or normal level rather?
Heart attacks, strokes, cancers, blood clots, you name it. You want to stay physiologic. You don't want to go to these super therapeutic levels because of the risks. And yes, men will feel like they're Supermen, they're He-Men. At what expense? So you want to stay within the normal physiologic range, which again is about 250 to 850.
Alrighty. Got one of our last questions here. I've been putting my topical testosterone cream in my scrotum, which is what I thought I was supposed to do, but I recently read that this is a bad idea. Is it?
Again, any skin will probably absorb it. Yeah, I don't recommend that area. The recommendation really is more, you want areas that are less hair because they'll be absorbed. So another part of the question with tattoo thing is if you got a lot of hair on your shoulder, you may want to shave that to be able to get it in to the actual area. If you got but I've heard of it. I have some guys, some patients have done it. I don't recommend it. But it's skin. So technically, as long as it's being absorbed, it might be fine.
Alrighty. We got time for one more question. I feel like this one is a good summarizing question. So what are some of the most commonly missed signs of low T?
A lot of the commonly missed signs that I'm a big proponent of trying to bring this out is more of the cognitive signs. It's amazing how many guys that I see that they come to me and they have this low testosterone and well, they got good sex drive, they got good erection, so I never really thought that this was an issue. But the one thing that they're just not performing at the level that they should be performing at. And it's interesting because they'll come back and they say, wow, I'm doing so much better work. I just made this goal and that goal. I never would have thought I would have done that. And so I think the one aspect, the one part of low T that has really gone under the radar is some of the cognitive defects that we'll see. I mean, I got some guys that are in their 50s that they're acting like they're 80, 90 years old. They're just not, their memory's not as good as it used to be. Even when they have conversations with other people, these people notice a difference. Yeah, he's changed. It's kind of worrying me because I thought he had Alzheimer's. And so I think the cognitive stuff is something that really is underreported, big time.
Alrighty, that is going to bring us to the end of our event here. If you'd like to learn more, you have a few options. There are more resources on the Resource Center located on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you'd like to compare any of the treatment options mentioned in this event, you can do so by going to menmd.com, navigating to the low T condition page, scrolling down to the treatment section, and selecting up to 3 testosterone replacement options to compare. You can also call MenMD at 857-233-5837 or log into the password-protected secure member portal to schedule an appointment with a MenMD personal health assistant.